Hi everyone, my name is Emma Witham, and for my epidemiology in the news presentation, I'll be focusing on ADHD and substance abuse, so the relation between ADHD and substance abuse. To start off, attention deficit hyperactivity disorder is ADHD. It's marked by an ongoing pattern of inattention or hyperactivity and impulsivity interfering with function or development. People with ADHD experience an ongoing pattern of the following types of symptoms. In simple terms, the frontal lobe is the part of the brain that helps you do work and complete tasks. Research has found that this part of the brain is smaller in people with ADHD. Other areas thought to be involved in ADHD are located in the basal ganglia, part of the brain that controls emotion, voluntary movement, and cognition. Research has previously found that the caudate and putamen regions within the ganglia are also smaller in people with ADHD. Okay. There are three types of ADHD: inattentive, hyperactive, and then the combination. Inattention is a person having at least 6 of the 9 symptoms that are listed below here, and very few of the symptoms from the hyperactive impulsive type, which are listed here. And then the combination type is the most common type of ADHD. People with symptoms of both the inattentive and hyperactive impulsive type will be persisting in the combination type. Alrighty. Inattention obviously means a person may have a difficulty staying on task, sustaining focus, staying organized. And all these problems are not going to be due to defiance, lack of desire, or lack of comprehension. It's going to be due to executive dysfunction as a result of someone's ADHD. All right. Hyperactivity would be the person, seeming to move about constantly, being driven by a motor, disruptive. And then impulsivity, of course, would be a person acting without thinking or having difficulty in self-control. We can already start seeing how some of these kind of characteristics of ADHD could be contributing to someone having a substance use disorder, or at least trying or using drugs or alcohol early on in life or at some point. Alrighty, now we're going to talk about some signs and symptoms of ADHD. Primary care providers sometimes diagnose and treat ADHD. They may also refer individuals to mental health professionals like psychiatrists or clinical psychologists who can do thorough evaluations and make an ADHD diagnosis. For a person to receive the diagnosis of ADHD, the symptoms of inattention or their functioning and impulsivity and hyperactivity have to be chronic, which means they're long-lasting. They have to impair the person's functioning, and they'll cause the person to fall behind typical development for their age. There'll be issues with stress, sleep disorders, anxiety, and depression, likely being coupled with ADHD, as well as other physical conditions or illnesses that can cause similar symptoms to those of ADHD, making ADHD sometimes difficult to diagnose because of its comorbidity with anxiety and depression. And a thorough evaluation is needed to determine the cause of these symptoms. Most children will receive a diagnosis in their elementary school years, especially for the hyperactive type. However, the inattentive type, especially in females, is not diagnosed usually until much later on in their life when they start to struggle in academics or in the workplace, or have repeated failed relationships and social issues. These symptoms can change over time as a person ages, but either way, they will still be representative of their original type. It just might manifest in slightly different ways. It's important to understand risk factors for ADHD. Of course, the etiology is unknown. Genetics may play a role. It is more likely for you to be affected by ADHD if you're a female than if you're a male. However, males usually have that hyperactive type, so they're easier to diagnose. There is a higher incidence of ADHD in males. Other mental health conditions like anxiety, depression, and bipolar disorder put you at a higher risk for being diagnosed with ADHD. And of course, there's low levels of dopamine. Related conditions to ADHD, as I mentioned before, be anxiety, depression, ODD, ASD, epilepsy, sleep disorders, and then dyslexia. Now, to treat ADHD, it's important to note that there is no cure. You can only manage the symptoms and try and manage your life to be able to properly function and, be able to not be crippled by that condition. Many treatments are currently available, like medications that are stimulants and non-stimulant medications. Examples of the stimulants would be Adderall, Vyvanse, and Ritalin. These non-stimulants, according to studies, don't work as well but can improve focus. There are also psychotherapy, psychosocial interventions that are options in behavioral and cognitive behavioral therapies. We know one of the most important roles of ADHD issues is this dopamine little compound here, and I'll tell you about that in just a second, but it's important to note it has a strong relationship and involvement in substance abuse disorders as well as ADHD. To define substance abuse, it's an overindulgence in or dependence on an addictive substance, especially alcohol or drugs. It's an unhealthy pattern of drug and alcohol use that would be inhibiting a person from being able to function, and their life is unable to be lived properly. Now, as I mentioned, dopamine plays an important role in executive function, motor control, motivation, arousal, reinforcement, and reward through signaling cascades exerted via binding to the brain's dopaminergic receptors at the projections found in the substantia nigra ventral tegmental area and arcuate nucleus of the hypothalamus of the human brain. Now, note that all of these functions that dopamine plays a role in are what people diagnosed with ADHD fail to function properly. You see that executive dysfunction is characteristic of ADHD. So you don't have executive function as dopamine does because you don't have enough dopamine. You have issues with motor control, that fidgeting, because you don't have enough dopamine. Issue with motivation and reward system and arousal reinforcement, you have no self-motivation. It's hard for you to do things yourself. Usually you don't want to start tasks if it seems like it's going to take a lot of effort and energy. Of course, dopamine is a neurotransmitter. It's been classically associated not only with ADHD, but also with the reinforcing effects of drug abuse, and it may play a key role in triggering the neurobiological changes that are associated with addiction. That would be because upon using these drugs, tons of dopamine is released, and that is a huge reward for your brain, and it makes you just want to do it again. And it'll rewire your brain to make your brain think that you need these drugs and alcohol to stay alive. Now we will talk a little bit about information we found in studies that were questioning the correlation between ADHD and substance abuse and using ADHD as a predictor for substance abuse disorders. We know that half of adults aged 20 to 39 with ADHD have had a substance use disorder in their lifetime. That is insane. Half of adults with ADHD have a substance use disorder. This is markedly higher than the 23.6% of all young adults without ADHD, so that'd be 50% versus 23.6% who have the substance use disorder in their lifetime. Even after considering factors like age, race, income, education, childhood adversities, and other mental illnesses, young adults with ADHD were still 69% more likely to have had a substance use disorder when compared to their peers without ADHD. Controlling for lifetime histories of mental illnesses and childhood adversities caused the largest attenuation of ADHD and substance use relationships. More than a quarter of those with ADHD had a history of depression, which was much higher than the prevalence among those without ADHD. And of course, depression would be a contributing factor to having a substance use disorder. These results emphasize the importance of addressing depression and anxiety when providing care to those with co-occurring ADHD and substance use disorder. Individuals with untreated depression and anxiety may self-medicate to manage the symptoms of an untreated psychiatric disorder, and this can be very, very dangerous. If your ADHD is poorly managed, or even if it is managed, but your underlying depression and anxiety is not managed, you might turn to smoking or drinking or doing drugs that really, really hit a dopamine for you to make yourself feel better, when eventually, in order to function, you rely on the dopamine that you're going to get from these substances and now you are an addict and your brain has been rewired to need those substances. Okay? Of course, this is resulting in greater substance use and a increased difficulty in managing ADHD symptoms. Another study out of Toronto says that those with ADHD also experience high levels of adverse childhood experiences, with more than a third of young adults, 35%, reporting they'd been physically abused, 1 in 9 reporting that they were victim of sexual abuse, 11% before the age of 16. We know there's a strong association between childhood adversities and substance use disorder that is supported by previous research, and we also know there's a strong association between childhood adversities and attention deficit disorder that has been proven by previous research. This childhood maltreatment, of course, may disrupt emotional regulation and neurodevelopment of children, which will predispose them to ADHD and a substance use disorder. Alcohol use disorders were the most common substance abuse disorder among young adults with ADHD, coming in at the highest of 36%, followed by cannabis use disorders at 23%. However, young adults with ADHD were also 3 times more likely to experience an illicit drug disorder besides cannabis when compared to their peers without ADHD at 18% versus 5%, which is still a huge difference. Now, the prevalence of ADHD, the estimated number of children ever diagnosed with ADHD is 6.1 million. This is 9.4% of all children. That's a huge, huge number. And we know that half of them when they're adults, so about 3 million of these people will have a substance use disorder in their adulthood, likely as a result of their ADHD. Here is a screenshot of the article I first found, highlighting the correlation between ADHD and drug use and addiction, and then of course the 3 supporting studies I've mentioned so far support the claim made by this article. We can answer the question, are drug abuse and alcoholism more common among people with ADHD? Absolutely. And a potential explanation for this is the extremely high rate of illicit drug use among those with ADHD would be that accelerated gateway hypothesis. This was created by a man by the name of Senyo. He's a recent graduate of University of Toronto, and he's a social worker in the University Health Network. His theory posits that people with ADHD tend to initiate substance use at a younger age, resulting in riskier use because of their high-risk reward behavior pathways, and they'll have a greater problem and severity in adulthood because they will keep using these substances. The data here is drawn from the Canadian Communities Health Survey of Mental Health, a nationally representative sample of 2,700 respondents aged 20 to 39 with ADHD and 1,600 without ADHD. The findings of that study underline the extreme vulnerability of adults with ADHD. There's a clear need to develop prevention and treatment programs to address substance use issues among those with ADHD, while also promoting mental health and addressing childhood adversities. We know that people with ADHD who have a history of depression, anxiety, and abuse are particularly vulnerable to substance abuse problems. Essentially, things that can be major risk factors in determining predictors for ADHD are also determining predictors for substance use disorder, and the high-risk behaviors associated with ADHD makes you more likely to, try these substances, which is that gateway foot in the door phenomenon, and then you're going to use them more often to try and fix underlying issues. Really, it's just going to be a downward spiral, of course, into the addiction. It's going to be a strong need to control the impulsive behaviors that are specific to ADHD to try and get people to break their addictive cycle and heal. Obviously, the study I mentioned earlier, including 7,000 Canadians aged 20 to 39 without ADHD, and then 7,000 with ADHD. They had marked trouble concentrating, sitting still, made impulsive decisions, and out of these people, 72% of them had substance abuse disorder in their history or a history of substance use. Of course, alcohol use disorders, as I mentioned, were the most common, with 1 in 6 young adults with ADHD having issues with illicit drugs, alcohol, and marijuana. We know that in all 3 of the studies I've mentioned, there's a strong connection between ADHD, drug abuse, and alcoholism, with someone being diagnosed with ADHD having 5 to 10 times more of a likelihood of being an adult alcoholic than people without the condition. And among these adults being treated for alcohol and substance abuse, the rate of ADHD is about 42%. So 40% of those, with abuse disorders being treated have ADHD, and then 50% of all people with abuse disorders have ADHD, which is just really interesting and is a super high amount. Obviously, treating ADHD is super important to try and avoid having issues with addiction, managing your ADHD with medications, whatever treatments, and trying to get support in advance and be educated on the high risk of having an abuse disorder. And this can hopefully prevent addiction, overdoses, abuse disorders, and those with ADHD, and help them stay better on course, since by themselves it's really hard, since they have a lack of impulse control and are more likely to break sobriety even if they have been sober for a long time. Obviously, those reward systems are so focused on getting the dopamine. The use of drugs and alcohol have this effect on ADHD because of the low self-control, and the data reflects this, and it's very important because this data helps us better understand risk for those diagnosed with ADHD and supports the idea that addiction is an issue with brain chemistry, isn't a result of poor decisions or bad behavior. Here are the studies that I used. Thank you.